Hey everyone, today we're talking about something incredibly important for understanding heart health: cardiac biomarkers. Now, if you've ever had chest pain or gone through heart related testing, you've probably heard names like troponin, BNP, or CKMB thrown around. These aren't just lab numbers, they tell us what's going on inside your heart, sometimes before symptoms even appear. So, in this video, we're breaking down the most commonly used cardiac biomarkers, what they mean, and why they matter, all in simple, clear terms. Let's start with the big one: troponin. Troponin is a protein that lives inside your heart muscle cells. When those cells are injured, like during a heart attack, troponin leaks into your bloodstream. That's why elevated troponin is one of the most sensitive and specific indicators of myocardial infarction. A typical reference range is 0 to 0.04 nanograms per milliliter, but that can vary slightly depending on the lab. What matters most is how high it goes and whether it's rising or falling over time. Next up, creatine kinase, or CK, and its cardiac-specific form, CKMB. CK is an enzyme found in the heart, brain, and skeletal muscles. CKMB is the version more concentrated in the heart, which makes it useful in detecting heart muscle damage, especially in the early hours of a cardiac event. The usual reference range for CK is about 38 to 234 units per liter, and for CKMB, it's typically 0 to 3% of total CK. It's less specific than troponin, but can still be helpful in certain clinical situations. Now let's talk about BNP and NT-proBNP, two biomarkers that give us insight into heart failure. These peptides are released when your heart is under stress, especially when the ventricles are stretched due to fluid overload. That makes them incredibly useful for diagnosing and monitoring congestive heart failure. For BNP, under 100 picograms per milliliter is usually considered normal. For NT-proBNP, the cutoff is often under 125 pg per milliliter, though this can vary based on age and kidney function. If someone's short of breath and we're trying to figure out whether it's from the lungs or the heart, BNP and NT-proBNP can offer a quick and reliable clue. Let's shift gears a bit and look at C-reactive protein, or CRP. Now, CRP isn't specific to the heart, but it is a marker of inflammation, and inflammation plays a big role in the development of atherosclerosis and plaque instability. That's why high-sensitivity CRP, or hsCRP, is often used to estimate cardiovascular risk, especially in people who don't yet show symptoms but may be heading down that road. Here's how we interpret it: under 1.0 mg per liter, low risk 1.0 to 3.0 milligrams per liter, moderate risk, above 3.0 milligrams, high risk for cardiovascular events. It doesn't diagnose heart disease, but it helps paint a fuller picture when used with other tests. Of course, no cardiac assessment is complete without looking at your lipid profile. That's your cholesterol and triglycerides. Here's what we aim for: total cholesterol, under 200 milligrams. LDL, the bad cholesterol, under 100 milligrams is optimal. HDL, the good cholesterol, over 40 milligrams per deciliter is ideal. Triglycerides, under 150 milligrams per deciliter is considered normal. Managing these numbers helps reduce your risk of coronary artery disease, heart attack, and stroke, especially when paired with lifestyle changes or medications. Now let's quickly touch on myoglobin. Myoglobin is found in both heart and skeletal muscle. It's one of the earliest markers to rise after muscle damage, including a heart attack. The downside? It's not specific to the heart, so elevated levels could be from a pulled muscle or trauma, not necessarily a cardiac event. Still, it can be useful when measured early, before other markers like troponin have had time to rise. So what's the bottom line here? Cardiac biomarkers are incredible tools. They give us real-time insight into what's happening with your heart. But they're not standalone answers. Doctors always interpret these markers alongside your symptoms, history, EKGs, and imaging. If you've recently had a test with any of these markers elevated, or you're trying to lower your risk, don't just stare at the numbers. Talk to your healthcare provider. Ask what the results mean in the context of your health, because it's not about one marker, it's about the whole picture. Thanks for watching, and I'll see you in the next video.